General practice primary care is under an awful lot of pressure. Workload's increasing, GPs in particular are struggling. We identified 7 intensive support sites across the country to focus a really significant degree of effort and energy in finding ways to retain GPs. Whether that's associated with supporting individual GPs, whether it's about redesigning and thinking about how the practice operates to manage workload and create a better environment, or whether it's about a practice being part of a wider system and how can it work differently and better with its neighbour.
The statistics tell us that GPs want to work 6 sessions a week in general practice. That does not mean they want to spend the other 4 sessions doing nothing. They want to do something else that stimulates them. When we're looking at incentivising portfolio careers, looking across the whole spectrum of first fives, mid-careers, and what we're calling our Y5s, our later career GPs. And the whole idea is to help diversify GPs. So they've got something else to do as well as their general practice work that will not only help them and enrich them, but also help enrich their local area. One example is Dr. Martin, who's a local GP who's looking at specialising in elderly care medicine.
The frailty, the elderly care stuff, it's really good kind of holistic general medicine, more focused on kind of maximising people's quality of life. The support through the scheme here has been a big help, and the more I get to kind of know the local services, know the people here, the more kind of embedded I feel in the kind of healthcare system.
Polypharmacy, frailty, big issues for general practice in our local area, which will hopefully help reduce the workload of GPs in itself, but also help reduce workload on other people within the health economy. My aim is to make sure that this area has our patients looked after with high quality GPs who are working not under stress, but also with good wraparound around them in terms of support. We want people to be happy in their jobs. The happier you are, the more productivity you get, the more productivity, less mistakes. It's almost a domino effect is how I feel and I look at this thing. It's about people making them happier.
There's a whole system solution that needs to be looked at where people can actually feel supported, and that is where quality improvement program was dedicated to that.
Everyone accepts we need to change. It's how do you do it? And so that's where this QI project really helped me, and it gave me the skills to set up my own QI project, which I'm running at my surgery at the moment. I just got data to look at all the paperwork every GP was getting and how much of that paperwork did a GP actually have to see. We decreased the documents by about 25-30%. The idea is to share the learning and get everyone, not just myself and my surgery improving, but everyone, so we can affect health borough-wide.
Once they've done that practice level of improvement, quality improvement work, the lessons learned from there is then expanded to the other practices within their patch. So the good quality improvement lessons are learned but shared to then improve quality at scale.
When we asked our GP colleagues, what is it that makes the job difficult and unsustainable, they told us it was about work-life balance. So we came up with this idea of moving to a much more digital solution. The only way to access the practice now is through Ask My GP. Those requests go to a central sorter. Lots of the work that is generated by patient requests, we can deal with that source by directing them to somebody else, because in the end, it isn't whether they get to see me, but they get their need met. We're seeing a lot less people face to face, but we're managing to deal with 95% of the work in the day.
I don't think anybody really expected the significant change that it's been, because basically response time has been cut in half. The practices themselves recognise that actually they do need to embrace change. We can have not just a more resilient and more sustainable primary care provision, but it can be better.
I'm really excited to have seen so much work and focus in each of the 7 intensive support sites. I think that sense of increased optimism and actually beginning to change perspectives about their future plans is some really tangible, really positive indicators that this work is beginning to make a real difference to real GPs on the ground.